do our best to help you understand it tonight.
The Dan Yorke State of Mind program is brought to you at part by Lookout Rhode Island and Takeo Comfort Solutions.
Great to have you in. I consider this to be, I don't know who else has evaluated it, but I consider this to be the most nimble half-hour pre-taped television show in America. And I mean that because we got a great staff and they do a great job keeping us up to date on local issues. But I'm very forthright and transparent about how we produce this program so you understand the content. And on Friday nights, most of you know, and a lot of you go, yeah, I know, Dan, I watch the show every night. You tell us every Friday. We tape our Friday shows on Thursday on a regularly scheduled basis. Each afternoon, we tape our programs. We tape Monday through Thursday, and Monday, Tuesday, Wednesday, Thursday, they're same day. And Thursday night's show runs Thursday. Thursday afternoon's taping runs Thursday, and then we do a second show for Friday. And we generally spread it out, you know, have a longer form conversation. It's usually less timely. But we thought that we would continue to tackle the coronavirus here, and we just have to admit that here we are taping at 2 o'clock on Thursday afternoon for the show you're watching right now. Heaven knows what's happened in terms of change between now and then, but I'm guessing the basics of the issues surrounding the virus will be pretty much constant, and so we'll do the best we can. So thank you for tuning in and your patience with that. Having said that, our latest at Showtime presentation from the governor's office was actually Wednesday afternoon. My guess is she's done an update since. But some of the themes are pretty consistent, and some of the changes that she initiated were pretty profound.
Aggressive, swift action so that we can contain the virus.
Governor Gina Raimondo says that her #1 goal with coronavirus is containment. To do that, she asked for the public's help during a news conference Wednesday.
To not attend or organize organized events of 250 people or more for the next 2 weeks.
She defined events as organized occasions where people will be in close proximity for an extended period of time. The governor's suggestion was supported by the Rhode Island Department of Health.
Everyone who cooperates with this now also becomes our unsung heroes.
The list of those cooperating started immediately. The Providence Warwick Convention and Visitors Bureau, Dunkin' Donut Center, and Rhode Island Convention Center all announcing event cancellations for the next 14 days. The governor is also asking that the most vulnerable to the virus, who are 60 and older or with underlying health conditions, not attend any events for 2 weeks.
We want to make sure it's clear that this is to protect older adults. We're doing this because we love you, and we want to keep you safe as our seniors in our community.
To avoid spreading the virus, the governor and Dr. Alexander Scott recommends keeping a distance of 6 feet away from others, as well as continue to wash your hands with soap and water, use hand sanitizer, cough into your elbow, and avoid touching your eyes and mouth.
If we do this now, and everybody follows these instructions for this short period of time, we'll all be better off in the long run.
You know, one of the interesting things about this is that I talked to Jim Finale, the CEO of Care New England, on the radio yesterday, and he was saying that you've been doing a good job paying attention, that all of this information is people really paying attention. So far, the hospitals have not been inundated. Obviously, we only have 5, again, at press time, confirmed coronavirus cases, but you know that's going to get higher when we start to get some more sophisticated testing. Jeffrey Bratberg is a professor of pharmacy at the University of Rhode Island. Was on with me the other day on the radio and gave some really good, easy to understand advice. Welcome. Thank you for coming. Appreciate it.
Thank you for having me.
Again, timing being what it is. I mean, this last whirlwind of time, again, 2 o'clock Thursday, recording this program, sporting events really are dominating the news cycle up until now, and literally PC was scheduled to play at a 2:30 start. URI was scheduled to play tonight in the Atlantic 10, and the games were canceled literally while they're tying their shoes, at least on the Big East side and the ACC side. And the A10 had already started the tournament, so officials are kind of catching up to, I don't know, a reality, data, momentum, action by guilty association? I'm not sure which. What's your take on everything that's been going on up until our taping time?
Yeah, I think that what we're realizing is what's been effective in other countries, and that knowing that we're not going to have medications or vaccines for a very long time, and knowing that you can go from a handful of cases or single digits of cases to hundreds or thousands of cases in a very, very short period of time. And we're probably going to see that as we expand our testing. The Rhode Island Department of Health and the CDC have very up-to-date data on how many cases, how many people are being tested, how many people are contacts, people under investigation, things like that. And you know, I think I've probably changed just this morning in researching for this interview that we really need to take social distancing seriously. And I was looking at some of the documents on the CDC and the Rhode Island Department of Health, and you know, it's if you're older than 60, if you have chronic medical conditions, if you have cancer or kidney disease or diabetes, those people are at higher risk of severe disease and death. But it's the severe disease and making sure we don't overwhelm the healthcare system. So those are the two groups that we prioritize to protect: healthcare workers, so that we can keep providing health, and people at high risk, again, people with medical conditions and who are older or who are older.
So your expertise, you're a professor in doctor's pharmacology, and you teach, but you've been looking at infectious diseases and all that kind of stuff for quite some time, right? So you're just not the guy who just goes and gets some high-powered aspirin off the table. You know?
Yeah. I mean, I strongly support our community partners, and they're integral into this effort and will be as medications get developed and vaccines get developed. You know, many tens of thousands of vaccines are for influenza and other diseases, other respiratory virus diseases are given by community pharmacists. But I teach public health. I focus on overdose response, which is also a public health emergency still in this state, and realizing and really connecting all the dots. I was really part of the the Department of Health's effort to figure out how to do pandemic flu response in 2009, and so was working in hospitals and the health department and pharmacies to get that effort. So I really think of it in a multi-pronged fashion, and I teach classes in this. I teach classes on how to recommend vaccines and things like that.
So I mean, it's so important to recognize that there's other things going on in the world, have been challenges that we're not just so emergently reacting to. The opioid crisis we've had in this state. We've done dozens of shows between the TV and the radio on this over the last few years. We called that a crisis.
Mm-hmm.
You still consider it a crisis?
Yes.
But there's crisis, and then there's crisis.
There's crisis, and really, you've probably called it the opioid epidemic, and that's,
sure.
You know, there's books with that title and lots of media on that. It's really a crisis because it doesn't look like coronavirus. It doesn't look like influenza or pandemic influenza. WHO declared this a pandemic, right? So, and really in name only. We don't change what we do. What I said last week, you know, again, this is Thursday, people are watching this on Friday, we still need to wash our hands and use hand sanitizer. And I think the next step is to say, okay, you know, when I came in here, everyone offered their hand to me. That's normal, that's what we do, right, in civil society. And we have to stop doing that.
Right.
No matter if that person is a young person or someone who's coughing or any of that. We should just change, and it's easy for me to say, you know, stop touching your face. But I think the harder thing in a democracy is to tell people not to go places, and to don't go to the tournament, and to close the school. I work at URI. We're off next week, and we're going online teaching, and I think, yeah, that's inconveniencing me a little bit. It's not as nice for the students to do that. Some schools have completely closed. That affects different students differently than others. Some people can just go home. Some people have to get their visa changed. You know, there are many considerations that go into closing things, and what some have called aggressive social distancing. But I think now is the time to do it, because we have to realize that the sooner we do it, just as the governor said, and the health department supports and CDC supports, the sooner we get people not in contact with each other for that 14 days incubation period, it's about 2 to 5 days usually, we can flatten the curve is really what we're calling it, because there's a peak, right? There'll be a peak and then it goes down. We see that with flu every year. We need to flatten it below that threshold of healthcare can take part if we have X number of cases, severe cases in our hospitals, and we can provide care in other ways, and we don't get our healthcare workers sick. But if we go above that, then we don't have a big pool of healthcare workers to draw on. We don't have a big pool of service workers. We don't have those pools of people just waiting to go help out.
Yeah. When we come back, we'll talk a little bit about that flattened curve. Stay with us. Yeah, so Brown and RISD jumped on the bandwagon. URI was early with Rick, and CCRI early this week. PC is on board now. It was funny, this morning, Thursday morning, as we were taping this, there was 100 schools that had decided to go online. I bet you it's 10 times that by the time the weekend goes. I don't know how many institutions of accredited higher learning we have in the country, but I would think that no one's going to want to be the outlier having kids come to class. Although there is, Professor, an interesting question, and I don't know the answer and haven't had a chance to research this yet, but a gentleman called me on the radio on WPRO yesterday and said, well, isn't this kind of a dumb idea if the kids are, or teenagers are less susceptible to serious infection, and you're sending them out into the communities where it's harder for them to regulate their behavior anyway? You know, what are we actually accomplishing? Shouldn't we keep them in one spot, in one central location, doing their thing normally when while they may not be immune to infection or isolated from it, at least they're in a contained environment?
I think this applies to any large social gathering,
Period.
right?
Doesn't matter who.
And you know, if we put people in their homes, they just have fewer people that they're being exposed to. If you look and see what I listened to a podcast on the way over here that in China, they didn't just quarantine people in homes because 70 to 80% of their transmission was in families. So if you had a fever, and they had these fever check stations everywhere you went, they would put you away from your family until they knew that your test was negative, right? They do a CT scan, they do a fever check. They would make sure, they would separate you at that point. I don't see that happening here, but that's the kind of emergent things that they've done in different countries to do that. Yeah, you know, it's inconvenient to close schools. It always is.
I'm not even talking about the convenience. You're just talking about the travel of the transmission of disease. Is it, you know, for younger people, moving them all off these campuses and dispersing them into the communities? It's not like they're going to sit around sucking their thumbs, you know. So it's.
I think we have to say that we were just saying at the break that it's all about reducing risk. And so if you expose people X number of hours a day to a whole bunch of people who then go expose a lot of other people, right, in some way, if we prevent that mixing of people together, that's the thing. And we have to separate out, children aren't as susceptible to severe disease. We don't know if they get mild disease and then are transmitting, right? So let's just say they're equally as able to transmit the disease as someone else. Well, when they go to Grandpa's 70th birthday party, and then Grandpa goes to the nursing home, you know, those are the kinds, or Grandpa goes to the annual, dinner with the other people who also are in that higher risk group.
Speaking of the transmission, and again, we're recording Thursday afternoon for our Friday show. There may be more information that is let out here, but there were two alarming numbers, or two alarming pieces of information I think came out this week. One, that Congress's doctor is telling Congress behind the closed doors that this is anywhere from 70 to 150 million people that could be afflicted with this coronavirus. The timetable of that is not necessarily described, so that doesn't mean this week. It can mean over the course of time, and what time, right? Especially when you see projections of 15 million people across the globe losing their lives to this thing. That is over a stretch of time, and it talks about countries, and everybody's equal in God's eyes here, right? But countries that are not super sophisticated in getting vaccines executed and the like, right? So you have to take these numbers with somewhat of a perspective and grain of salt. Well, before I offer the second, tell me what you think about that number.
Yeah, I think.
You think that number's real?
It's all about, again, it goes into risk, is that we're not going to see large numbers of children dying from this, we think, at this point. We know from Chinese data that people over 80 have maybe a 20% death rate, right? So how do we protect that population? And higher death rates above 70 and higher above 60 and higher in people with cancer, higher in people with diabetes. Half of the people who have diabetes in this country don't know they have it, right? So we have people who have unknown risk factors at the time of presenting with fever, cough, and maybe shortness of breath, which distinguishes it from the flu, is that shortness of breath from influenza.
I even heard a doctor today, though, saying, hey, infectious person saying, we're not ready to completely say that shortness of breath doesn't occur with the flu either. So that people are getting very tentative about their identity for this, which only begs the question: we need testing like it's going out of style, and the leadership in this country has completely let us down when it comes to being prepared for this whole thing. Seems to me. But in South Korea, it seems like the number of fatality, the rate is down to or less than 1%. Because of their level of sophistication in testing, right? Seems to they have better data than we do.
They have better surveillance data, right? So, I mean, there's a test. It's made by the World Health Organization. It's being used in Italy and China and Germany. We could use that test. I don't know why we're not. We're making tests. From what I read, that we're going to have expanded testing soon. Like we said last week, we don't want to say that there'll be some X number of tests available and who's able to get tested. And I think it
really is the fall down in response is the testing. The president's ridiculous rhetoric and his defiance of the truth on this whole thing, almost as if he was afraid of it. And even his address the other night, not even getting his own.
He might have been exposed from the Brazilian
who knows?
Public relations person.
Some of the terrible stories that you've heard, the doctor in Washington State who knew she had a problem, had testing available, not by CDC authorized means, but was preempted from the CDC for using the tests that she was looking for. And now the CDC has kind of discharged some local responsibility, with their approval on protocols. It's a mess, and I'll tell you, past this thing, we better have a formidable infectious disease strategy, don't you think? I mean, it's...
Well, we did, and then it was eliminated.
By the Trump administration. Yeah. Make a note on that. When we come back, there's some other infectious conversation from investigators. We'll talk about that next. The professor suggested that we put some Purell up here for does the camera actually get that, or does it go right through? Depends on the size of the bottle. But yeah, you got to use that stuff, man. You got to use it, but soap and water, and there are some cute videos out there online. Kids are doing them in terms of the way you wash your hands, and there are significant ways that you can wash your hands to make sure everything. So you should check out the video. Another 20 seconds isn't going to kill you. I was concerned earlier today, again Thursday for the taping on Friday, that there's some research out there that this particle, this virus, might live in the air for 3 hours or so. That's another one that the surfaces need to be cleaned. The 6 foot distance is droplets of coughing.
Correct.
The 6 feet's usually their expiration, right?
Yep.
I guess if you're a real projectile cougher, you could go 8 feet or whatever.
Yeah, I mean, I think we know from extensive study of influenza viruses, which are also droplet transmitted, that I think we need to just, until we verify that, we need to see what's going on. Let's just do the one thing at a time. Let's still wash our hands, still use soap and water.
Right.
Don't make your own hand sanitizer, things like that.
Yeah. Do you think there's any credence to this notion that I'm guessing the airborne status is still within the 6 feet. I'm guessing that's what the media's done a terrible job in the last 24 hours of explaining what that means. I don't think we're talking about measles, tuberculosis type of air passage, right? I don't think we're doing
that. I'm glad you brought that. Yeah, measles or tuberculosis, if somebody who was in here 2 hours ago and they had measles and you were susceptible and came in, you would get measles. Okay, so that's airborne spread. That's the most infectious agent we have. That one person can spread measles to 30 other people, where for the virus that causes COVID-19, it's maybe 2 or 3 people, as far as we know at this point. I wouldn't give any credence to airborne transmission. If it keeps people social distancing, that's something you need to do, no matter how it's transmitted. I think that's the important thing.
You don't give it credence because your instinct
I don't know
tells
any
you.
data.
Yeah.
I don't know any data about it.
Yeah. So there's been
Is
a
it possible? Sure, but you know, the biggest it's the thing to fear is fear itself. And I think, like I said on the radio program last week, is that think about, people just want to know what they can do, right? So they hear that toilet paper is running out, and I probably shouldn't say that because then everybody will be reminded they need to go get toilet paper. But when you hear something's out, then it's short, and then you want it, right? People only want the vaccine when it's short, right? Whatever it is. And so we need to say, there are things that you can do to get prepared for this and for anything else. And if you're prepared, your anxiety goes down. If your anxiety is down, your kid's anxiety is down. You can talk to people about it. You know, I'm calling my parents who are elderly and live in Minnesota and saying, here's what you need to do. Called my brothers and said, how you doing? Here's what you need to do. Because I'm prepared and I'm knowledgeable. And so here's where you provide good knowledge. I said, you know, send out my brother told me that the Facebook post I had from the Rhode Island Department of Health was perfect and calmed his family down. So that's the kind of things I like to hear and tell your listeners, to say, keep doing those things. To say, here are the things you can do. If you're prepared, your family's prepared, and we're ready to help out our community.
And it really is kind of, it's been overdone perhaps for some, this notion that you're a hero if you're abiding by a lot of the social distancing stuff. But the truth of the matter is that this hospitalization curve, staying under this curve, it's really going to be the key. I don't know that the actual organism dies itself, but it seems that the longer you stay under the curve, the better. Tell me.
The curve,
we don't know if the summer is going to kill this thing anyway. It doesn't feel like it.
We should expect this to happen. That's the one thing I could tell your listeners is, don't expect this. I've heard that from many sources. We do not. It's a novel virus. We don't know. It's a respiratory virus. It has similarities to other respiratory viruses like influenza. We don't know that. We can't pick a day when it's going to be done. It's not May 1st, all of a sudden we have no cases. Remember, there's that incubation period. Let's just say it's 14 days, right? So that if I'm self-quarantining or isolating for 14 days and I haven't gotten exposed, that means I won't expose other people. But those cases build up quite rapidly. If you go, you know, think about how many people you contacted today. How many people were you around today? 20 people, 30 people? So that's why you bring it to schools. There's a lot of people getting exposed there.
All right, appreciate your thoughts. We'll tell you about his Facebook page and where you can get more information next. So you can take a look on Facebook. What is the page? It's
if you search Jeffrey Bratberg, you'll find
Jeffrey
him.
Bratberg. So check that out. URI, pharmacology expert. You'll find it. There's so much online. You should spend some time online doing some good reading on multiple sources. Have a good weekend. Remain calm, remain safe and smart. Wash those hands, and we'll talk to you on Monday. Bye.